The esophageal tracheal tube is a supraglottic device that providers can insert without interrupting chest compressions and without visualizing the glottis. The esophageal tracheal tube is made up of two lumens permanently stuck together. Each tube can provide oxygen to the patient, depending on how it's inserted. The longer blue-colored tube, marked with a number 1, provides ventilations through 8 small openings in the pharyngeal section. The shorter, clear-colored tube, marked with a number 2, provides ventilation straight through the end of the tube. Once inserted, the distal end of the device will either rest in the esophagus or the trachea. If the tube rests in the esophagus, which happens most frequently, the cuff blocks the esophagus and air flows through opening number 1. If the tube comes to rest in the trachea, however, the provider can use opening number 2 to deliver ventilation without having to reinsert the device. The esophageal tracheal tube comes in 2 sizes. A 37 French is used in patients who are 4 to 5.5 feet tall. A larger tube, a 41 French, is used in patients more than 5 feet tall. To insert the esophageal tracheal tube, verify that the cuffs will hold air. The pharyngeal cuff, marked number 1, requires 100 milliliters of air. The distal cuff, marked number 2, requires 15 milliliters. Deflate the cuffs and lubricate with a water-soluble gel. Hold the esophageal tracheal tube in your dominant hand. With your other hand, grasp the tongue and jaw between the index finger and thumb and pull to fully open the mouth. As you insert the tube into the mouth, avoid catching the cuffs on the patient's teeth. Advance the tube smoothly but continuously until either the teeth or the ridge of the gums is between the 2 black rings on the tube. Do not force the tube. Keep the device in a midline position by aligning the black stripe on the tube with the nasal septum. Once the tube is situated, use the large blue syringe to inflate the pharyngeal cuff through the port labeled number 1. Then use the smaller syringe to inflate the distal cuff through port number 2. Begin ventilation through blue lumen number 1, checking for adequate breath sounds over both sides of the chest and over the epigastric area. Watch for chest rise. If the esophageal tracheal tube is correctly seated in the esophagus, you should hear no sounds in the epigastric area when you squeeze the bag mask device. However, if you do not detect chest rise or breath sounds, this may mean that the tube is seated in the trachea. Connect the bag to the clear lumen, marked number 2, and provide ventilation. Verify breath sounds and watch for chest rise. Caution: it's critical to confirm the proper placement of the esophageal tracheal tube because inflating the stomach with air can cause fatal complications.